Hello students. Welcome to Concepts of Care for Patients with Oral Cavity and Esophageal Conditions. Actually, this chapter has a lot of key terms and all of them are very important. So I just let you here to review by yourself. Extra attention to erythroplakia, esophageal gastroduodenoscopy, GERD, hiatal hernia, leukoplakia, sialadenitis, stomatitis, upper endoscopy, volvulus, very important, and serostomia. Okay. The priority concepts for these chapters are tissue integrity, nutrition, gas exchange, and pain. So, oral cavity disorders can severely affect psychological well-being, speech, body image, and self-esteem. Those at high risk include people who use tobacco and or alcohol. Please take a note of this. Eat food that is high in sugar content. Okay, when I say food high in sugar content, not only we are talking about the cookies or sugar itself, right? We are talking about pasta, we are talking about food that are having like a lot of fructose, like fruits with high content of fructose, for example, bananas, apples, watermelon, grapes, oranges, mango. Okay, those are foods with high amount of fructose, which is high in sugar content. Milk, regular milk, is a carbohydrate that is high in sugar. Okay, that's why many nutritionists recommend almond milk or the derivatives from milk, like for example oatmeal, flaxseed milk, milks that you can make from seeds, or low fat milk. Okay, but pay attention to and prefer to buy milk that is organic, from cows that are grass fed. Okay, if you are going to switch, having adequate exposure to fluoride, have pre-existing oral health disorders. That's why I explained to you in class the importance of prevention. You need to go to the dentist twice a year, and there are some other measures that I share with you in class that I'm not going to discuss in these videos. However, in the supplemental material, you are going to find all the recipes that I shared in class. Okay, have limited access to community oral health care, or have systemic diseases like atherosclerosis, diabetes, Alzheimer's disease. Okay, oral cavity conditions. Let's start with stomatitis. It's a broad term that refers to inflammation within the oral cavity, painful inflamed ulcerations called aphthous ulcers or canker sores, right? That the roid tissue integrity of the mouth are one of the most common forms of stomatitis. The patient at risk of bleeding and infection are the one that are having a lot of pain, right? So treatment ranges from topical applicants to opioid analgesics and or antifungal medication. So etiology, primary stomatitis includes aphthous stomatitis, non-infectious stomatitis, herpes simple stomatitis, and traumatic ulcers. As I mentioned in another chapter, once you get herpes, you're going to herpes for life. The thing is that the herpes is going to be dormant until some stressors or other environmental or any other condition will awake the virus, but it's going to be in your system. Okay, secondary stomatitis generally results from infection by opportunistic viruses, fungi, or bacteria in patients who are immunocompromised or as a result of chemotherapy, radiation, or steroid drug therapy. So that's the reason for secondary stomatitis. Okay, let's continue. So secondary stomatitis is caused by Candida albicans. This is a most common type of secondary. Long-term antibiotic therapy can destroy normal flora, which allows Candida to overgrow. The result can be candidiasis, moniliasis, a painful fungal infection. So let me show you here how this looks like. When we are talking about long-term antibiotic therapy, I want you to understand this in two ways. Either you are having an antibiotic, there are patients that are elderly patients that are in a very often presentation of UTI. So the doctor, for example, is going to prescribe antibiotic for chronic, for long periods, right? And some other patients, they are going to have different types of conditions. For example, one day the patient is going to present with type of infection in the skin, so that patient is going to get antibiotic, let's say in January, right? Then in February the patient is having UTI, the patient is going to have another type of antibiotic, right? Then on March the patient is going to have let's say ulcers in the mouth, so it's going to have another type of antibiotics. So right there you have a patient that got three different types of antibiotics, right, within 3 months. So it's already exposed, okay, and is developing resistance. So that is not good. It's better to prevent, and there are different ways to prevent this type of infections. Anyway, so when we say long-term antibiotic therapy can destroy normal flora, which allows Candida to overgrow, the result can be candidiasis, a painful fungal infection. That's something you need to consider, right? The infection can come from any type of long-term, either a long-term for a chronic condition, like they are elderly having UTI permanent. I've seen elderly that they are getting their antibiotic treatment, and then you tested them, they are negative for UTI, and after 2 weeks or 3 weeks, when you test them back because they present to the clinic with UTI symptoms, then again the problem is present. So that's why the doctor will prescribe long-term and chronic antibiotic therapy. Okay, risk for candidiasis. So older adults are at risk for candidiasis because the immune system naturally declines during aging. And especially those with diabetes or malnourishment, or those under great stress. So taking multiple medications, which is called polypharmacy, it can cause candidiasis due to oral dryness. Okay, pay attention to those patients in polypharmacy with many comorbidities. Stomatitis can result from infection, allergy, vitamin or mineral deficiency, especially complex B vitamins, folate, zinc, iron, systemic diseases, and irritants such as tobacco and alcohol. Certain foods such as coffee, potatoes, cheese, nuts, citrus fruits, and gluten may trigger allergic responses that cause of those ulcers, and that's good to know. Sorry, as I mentioned in class, these comments, that's good to know, NCLEX alert, are coming because I've seen questions in NCLEX that has this specific information, and also in different reviews that I show you. Okay, so once you are studying for your NCLEX, Take notes for these comments, not only for the exam, but also to prepare you for your NCLEX examination. Not only for your exams during the semester, but for the NCLEX, okay? Okay, so pay attention to these foods: coffee, potatoes, cheese, nuts, citrus fruits, and gluten may trigger allergic responses that cause aphthous ulcers, okay? Okay, let's continue. Incidence and prevalence: recurring aphthous stomatitis affects about 20% of the general population and is more commonly found in females. Proper oral hygiene can decrease the frequency and severity of stomatitis. So a good proper oral hygiene is to start the day with the recommendations we share in class, and then use your toothbrush twice a day. Or if you can do it after meals 3 times a day, that would be excellent. Maintaining a healthy oral cavity: eat a well-balanced diet and stay hydrated by drinking water that while you are rinsing the mouth, right, the oral cavity. Manage stress, because we know stress increases inflammation and decreases the activity of the immune system. Now, perform a weekly self-examination of your mouth. Report occlusion of teeth, mouth pain, or swelling to the primary healthcare provider. Avoid mouthwashes that contain alcohol, please, which can damage tissue integrity. Avoid drugs that increase inflammation of the mouth or reduce saliva flow. See your dentist regularly. Okay. Reduction in saliva, right? We were talking about avoid drugs that increase inflammation of the mouth or reduce saliva flow. So what medications are reducing saliva? Your antidepressants, diuretics, your water pills, antihistamines, your Benadryl, decongestion, medications for Parkinson's disease, right? Blood pressure medications, your beta blocker, all your LOLs, your propanolol, your lobetalol, okay, and inhalers, those that are used by asthmatic patients. So those decrease the production of saliva, okay? Pay attention to that. Now, history: ask about a history of recent infections, nutritional changes, oral hygiene habits, oral trauma, and stress, right? We need to go to the dentist every 6 months. Also collect that drug history, as we mentioned, what type of medications, including over-the-counter drugs, herbal supplements, and nutrition. Document the course of current symptoms and determine whether stomatitis has occurred in the past, because since you're having this problem once and you don't correct the causing agent, the causative problem is going to come back. It's going to be recurrent. Ask whether the lesions interfere with swallowing, eating, or communicating. Severe stomatitis and edema have the potential to obstruct the airway. Okay, this is a safety issue that you need to be aware for your NCLEX. Anything relating to safety, nursing interventions, pre and post procedure, patient education, for sure will come in NCLEX. In cases of oral candidiasis, white plaque-like lesions appear on the tongue, palate, pharynx, and buccal mucosa inside the cheeks, okay? When these patches are wiped away, the underlying surface is red, sore, and painful, and tissue integrity is compromised. So that's good to know. Candidiasis is related to white plaque-like lesions. NCLEX alert, okay? Candidiasis equal to white plaque-like lesions that are able to be wiped away. Keep that thought. Candidiasis, you can wipe away these plaque-likes, and at the bottom you're going to see red, sore, and painful tissue. That's the difference with other conditions that we're going to study in a few minutes. But in candidiasis, you can wipe away these cells. Now, physical assessment, signs and symptoms. Okay, assess for lesions, coating, and cracking. If lesions are seen along the pharynx and the patient report dysphagia, difficulty with swallowing and throat pain, the lesions might extend down the esophagus. So, as we mentioned in class, the order of the tubes in our gastrointestinal. So first in front, in the neck, right, you have the larynx. Okay, larynx. Then you have the trachea, and in the back is the pharynx, that is the one connected to the esophagus. If lesions are seen along the pharynx and the patient reports dysphagia, difficulty with swallowing or throat pain, the lesions might extend down to esophagus. Okay, so that's good to know. LTP, larynx, trachea, and pharynx. Okay, a good way to remember to make a difference between larynx and pharynx is larynx is equal to loud, meaning voice, sound, loud. So it's going to be the first, right? Loud first is in your vocal is related to the sound, right? Loud, and then it's coming the trachea, and at the back is the pharynx. Okay, okay. And also I remember this P of pharynx is dysphagia, which also has the P, dysphagia. Does not have dysphagia, right? So it's not related to larynx. It's pharynx, P, pharynx, dysphagia. Okay, so the first one is larynx, then the trachea, and then is pharynx. Okay, psychosocial assessment. Assess the patient ability to cope with pain. And then the patient body image or self-image is important. To see how the patient is going to be able to cope with this condition. So here you have a nice picture of oral candidiasis, right? You can see the white patch, white plaque-like. Okay, so the most important things we need to worry about is impaired tissue integrity due to oral and or esophageal lesions, and also pain due to oral and or esophageal lesions. Okay, action alert. Airway obstruction, aspiration pneumonia, and malnutrition can result from dysphagia, difficulty swallowing. Airway obstruction, aspiration pneumonia, and those are due to the fact that the pharynx is close to the trachea, and they are both kind of separated by, there is an sphincter, there is a bulb over there that is going to be closed or open in the moment you swallow, right? So think about it. That's why I made the remark about how the tubes are located in that area. Assess for signs and symptoms such as coughing or choking when swallowing, a sensation of food sticking in the pharynx, or difficulty swallowing. If you know your map, guys, you can answer any questions. If dysphagia is suspected, use the PASS acronym for quick assessment. Probable that the patient will have swallowing difficult, account for previous swallowing problems, screen for signs and symptoms, and obtain a speech language pathology referral. And that's good to know. NCLEX alert. Okay, now preserving tissue integrity, so that's the first factor that we need to worry. What interventions are we going to do? Delegate oral care to assistive personnel, as this task falls within an AP skill set, and inspect the patient's oral cavity when the AP is done. So that's another thing is coming in NCLEX. You need to know exactly what is within the scope of practice duties of a nurse, an LPN, and the difference with the CNA, Certified Nurse Assistant, okay? So your assistive personnel, which is your CNA, they can perform this task, right? Oral care. Best practice for patient safety and quality care. Um, Remove dentures if the patient has severe stomatitis or oral pain. That's logic. Encourage the patient who is able to do so to perform oral hygiene twice daily after meals and as often as needed. I mentioned this. Increase oral care frequency to every 2 hours or more if stomatitis is not controlled. So it's not too much. It's good. When stomatitis is out of control, try to perform oral care to every 2 hours. Teach patient to use a soft toothbrush. Encourage frequent rinsing of the mouth with warm saline, sodium bicarbonate, baking soda solution, or a combination of these solutions. And I told you in class how to do the organic coconut oil pulling. 1 tablespoon for 15 minutes first thing in the morning, right? For 15 minutes. And this is also good for diabetic patients. Many of the patients that are having gastrointestinal problems are having a chronic state of inflammation. So you're going to be amazed how this pulling is going to pull mucus from the throat. Yes, not only is going to clean, but it's going to pull mucus. That is also happening to many patients with rheumatoid arthritis, patients with COVID, and patients who are having any respiratory or any flu or cold. You do the oil pulling, mucus is gonna come. They are even opening the ears because that area is connecting the nose, the ears, and the throat. So you're going to have mucus coming out and everything is going to start getting clear. Nose, the ears, the throat. Oil pulling, okay? And then you use your toothbrush and your toothpaste, whatever it is. Drug therapy used for stomatitis includes clotrimazole troches, nystatin suspension, switch and speed, or chlorhexidine switch and speed. And also I told you that we use this liquid presentation of nystatin whenever we suspect that the problem is only in the oral cavity. But when we have patients that are having a systemic, we suspect that this tissue, the stomatitis, is going through the esophagus, right? Patients are going to tell you, I have dysphagia, odinophagia, which is pain swallowing. Probably those little aphthous ulcers are going to be through the esophagus. Then you're going to prescribe the nystatin, or the doctor is going to prescribe the nystatin in the tablet form, okay, to cover the area. Okay, think about your chemotherapy patients. Minimizing the pain, what are we gonna do? Cool or cold liquids can be soothing, whether it's hard, spicy, salty, and acid foods or fluids can further irritate the ulcers. Think about your Latino community, your Hispanic community, that they love to eat spicy foods, especially Mexican. In South America, Peruvian, Ecuadorian, they love their ceviche with high levels of spicy. Now think about your Hindu patients, right? Their delicious food is very spicy. So all these patients are in risk. Include foods high in protein to promote healing. Vitamin C may be recommended as a supplement. However, eating citrus fruit, which are rich in vitamin C, may be painful, okay? Over-the-counter oral anesthetics can be recommended. Prescription drugs such as switch and speed agents for pain management include your 2% viscous lidocaine, your diphenhydramine liquid, that's your Benadryl in the liquid presentation, diclonine lozenges, aluminum hydroxide, magnesium hydroxide, and simeticone suspension, and atapulgite suspension. I don't know. Anyway, so far so good. Nursing safety priority, and that's good to know. NCLEX alert. Teach patient to use viscous lidocaine with extreme caution. Lidocaine causes a topical anesthetic effect, so patients may not easily feel burns from hot liquids. Okay, as sensation in the mouth and throat decreases, the risk for aspiration rises. NCLEX, that's good to know. I've seen this in my books, in my reviews, okay? Not only during the exam, but also during in my reviews. Okay, so we have an NCLEX examination challenge question 46-1. I also recommend you to check your book in the student resources. Look for the chapter and look for the answer keys. So the question is, the nurse has provided teaching about maintaining a healthy oral cavity to people at a community health fair. Which of the following individuals would the nurse identify as being at high risk to develop an oral cavity disorder? Select all that apply. Older adult with diabetes, of course. Adult with a past medical history of skin cancer, is not. Individual who is homeless, that means that has a poor oral hygiene and has no health insurance, of course. It's going to be hard for this person to go to dental care. Someone who has smoked a pack of cigarettes daily for 1 year, of course. Person who uses the food pyramid to consume several small meals daily is not. And the reason the one with the skin cancer is not because the presentation is skin cancer. We are talking about oral oral health. Care coordination and transition management remind the patients to take all medications as prescribed, especially antibiotics. Teach about possible side effects. That's something that sometimes we don't do as nurses when we are discharging a patient, because we believe that it's enough with the recommendations that are coming stick in the bottles of the medication. It's not enough. Sometimes our elderly population, they don't read the recommendations, okay, and they don't read the prescription. They don't pay attention to the doctor's instructions. I had a patient who the doctor made a mistake to order amoxicillin for 10 days for a respiratory issue. Sorry, but the doctor made a mistake and ordered that prescription for 30 days. So the patient came to the office stating that she felt very well and she thought that she doesn't need the amoxicillin for 30 days. That's how they figured out the doctor was giving the wrong prescription. The pharmacy did not call the office to make the provider alert. So the elderly was lucky enough to come and say, hey, I feel better. I don't know why I have to take this for 30 days. Okay? And the pharmacy kept giving her the antibiotic. So in this case, she was lucky, but who knows? Other elderly, yeah, right? So mistakes are being done very often, and these mistakes extend to the pharmacy. Okay, so nurses, if we have the chance, if you work in home healthcare and you are doing your medication reconciliation, you just need to double check what is the prescription. Dietary choices. that will not irritate the oral cavity, and how to you're going to teach, right, dietary choices that will not irritate the oral cavity and how to gently brush to promote good oral hygiene. Okay, so there are many types of toothbrush in the market, right? You're going to suggest the patient to select the one that uh, is in the soft level, not the firm, right? Oral tumors. We are changing subjects. Premalignant lesions. Tumors of the mouth, whether benign, precancerous, or cancerous, can affect swallowing, chewing, and speaking. Oral tumors affect body image, especially if treatment involves removal of the tongue or part of the mandible or requires a tracheostomy. So erythroplakia, which is considered precancerous, appear as red, velvety mucosa lesions on the floor of the mouth, tongue, palate, and mandibular mucosa. And that's good to know. NCLEX alert. You need to know the terminology. Erythroplakia, okay? Red, velvety mucosa lesion of the floor, on the floor of the mouth, tongue, palate, and mandibular mucosa. Then you have leukoplakia. Is cause thickened, white, firmly attached patches on the oral mucosa that cannot easily be scraped off. And this is the one that, do you remember I told you a few minutes ago, hold your thought, right? Because candidiasis is going to present as a white plaque-like lesion that you can scrape, so you are going to see at the bottom the red tissue. In leukoplakia, okay, these are thickened, white, firmly attached patches of the oral mucosa that cannot easily be scraped off. Okay, that's the difference with stomatitis and white plaques. Okay. And most of these lesions are benign. However, lesions of the lips and tongue can progress to cancer. Tobacco uses increase the chance of development of leukoplakia. Look at this picture. Okay. And this is a presentation of hairy leukoplakia. You can see in between, inside the white patches, you can see these lines that are that seem like little hair, right? That's why they call hairy leukoplakia. Okay, core measures. Always ask patients about current or historical tobacco use. That's the most important. Okay, long-term oral mucosa membrane irritation also are causing this condition. Let me go back to the concept. Most of these lesions are benign. However, lesions of the lips or tongue can progress to cancer. Tobacco increases the chance of developing leukoplakia, and also long-term oral mucosa membrane irritation, poor fitting dentures, check chewing, broken teeth. Okay, some patients, they have their dentures forever, and because patient A is aging, then these dentures needs to be revised. Okay, so they need to be adjusted within time. So poorly fitted dentures, cheek chewing, broken teeth can precede development of leukoplakia. Oral hairy leukoplakia, which is in the picture, develops in people with immune compromise. It is often found in those with human immunodeficiency virus. So when you see the oral hairy leukoplakia, think about HIV as an early symptom, or Epstein-Barr. That's another virus that once you get it, you will get it forever. Herpes, which is the same family, huh? Epstein-Barr virus is the same family. So this virus is also known as the kissing disease. Epstein-Barr virus is a common and highly contagious herpes virus that spreads throughout bodily fluids like saliva. Okay, your Epstein-Barr virus from the family of herpes. So you see oral hairly leukoplakia, think about HIV and Epstein-Barr. Okay, so we continue. Oral cancer. Okay, teach adults to visit a dentist at least twice a year for professional dental hygiene and an oral cancer screening. So you need to go to the dentist twice a year. Uh, Let the dentist do the x-ray to identify any infections or different types of teeth problems. Prevention strategies including stopping use of tobacco and alcohol, avoiding sun exposure to lips, and avoiding exposure to HPV, human papilloma virus, a sexually transmitted infection. And I don't go through the explanation how HPV is getting into the oral cavity. So this is NCLEX alert. Health equity, HPV related oropharyngeal cancer. White men have a much higher incidence of HPV related oropharyngeal cancer than other men. Advocate for men to be vaccinated for HPV and to have regular oral cancer screening. So here you have a nice pictures of oral cancer. Okay. Now, industrial workers, pay attention to this because for me this was a very nice piece of information. I didn't know this. Industrial workers who have prolonged exposure to polycyclic aromatic hydrocarbons are at a high risk for development of oral and other cancers. So these are your textile workers, plumber and coal and metal workers, okay? Pay attention to this. We all know some people, a friend, family member who is working in this area, so they are candidates for oral and all other cancers. The risk is compound with the patient has human papilloma virus. So the risk is compounded if the patient has human papilloma virus. People with periodontal disease, gum disease, in which mandibular jaw bone loss has occurred are also at risk. And recently, one celebrity was diagnosed with periodontal disease. Who's the celebrity? Alex Rodriguez, ex Jennifer Lopez boyfriend. Okay, so this happens in the best families. People with periodontal disease, gum disease, in which mandibular jaw bone loss has occurred are also at risk. So here you have the picture of the periodontal gum. You can see that those red spots in the gum, okay, in the border of the teeth. Pathophysiology review. Okay, so you have most oral cancers are squamous cell carcinomas that begin on the lips, tongue, buccal mucosa, and oropharynx in people over the age of 40. Oral lesions that are red, raised, and erode are suspicious for cancer. A lesion that does not heal within 2 weeks or a lump or thickening in the cheek warrants further assessment. Okay, you have 2 weeks to heal. Basal cell carcinoma of the mouth occurs primarily on the lips and is related most closely to sunlight exposure. So the way I remember this is that basal cell carcinoma is related to sun, right? So I remember your sun B basal cancer related to the sun B. Okay, the lesion is asymptomatic and resembles a raised scab. With time, It evolves into a characteristic ulcer with a raised pearly border. Now you have Kaposi carcinoma is a vascular tumor appearing as a raised purple, reddish, or brownish nodule or plaque, which is usually painless. It can be found on the hard palate, gums, tongue, or tonsils. It is most often associated with acquired immunodeficiency syndrome. So that is the Kaposi carcinoma is more related to your HIV patients. Then you have your squamous cell carcinoma, right? That is not going to heal within 2 weeks. Um, and then you have your basal cell carcinoma, which is related to the sun, right? So you have three types. That's why if you remember once, the sun B, right, is good enough. And then you make the difference in the comorbidity of the patient, and you are good to try to attempt a diagnosis. Oral cancer risk. Genetic variations in patients with oral cancer have been found, especially the mutations of TP53 gene. The tumor protein P53 is essential for cell division, regulation, and prevention of tumor formation. Now, another NCLEX question. The community nurse is assessing people at a health fair. Which person would the nurse encourage to seek a dental appointment for an oral cancer screening? You have 28-year-old with Epstein-Barr, 36-year-old who recently traveled outside the country, 55 with a slightly low body mass BMI, or a 76 with prolonged exposure to polycystic aromatic hydrocarbons, and that's the answer. So key features: oral cancer. We spoke about bleeding from the mouth, poor appetite, because it's going to become painful, right? So the nutrition is going to be compromised, difficulty chewing or swallowing, unplanned weight loss, thick or absent saliva, painless oral lesion that is red, raised, or eroded. Factors to be considered in assessment. Let's go to assessment. Assess the patient oral hygiene regimen and use of dentures or oral appliances. So guys, so far we need to understand that we need oral hygiene. Okay, we need to avoid tobacco. We need to avoid alcohol. We need to avoid exposure to dangerous viruses like herpes, HPV, Epstein-Barr. Okay, we can prevent that. HPV, we can prevent that, right? I don't need to explain that. Epstein-Barr, the kissing virus, we can prevent that, right? So you need to observe, right? You need to, if you do your twice a year visit to the dentist, you can prevent many conditions. Okay? Okay, so assessment. Assess the patient oral hygiene regimen and use of dentures or oral appliances. Ask about oral bleeding, alcohol, tobacco use, difficulty eating, chewing, or swallowing, and whether the patient has experienced unplanned recent weight loss. Assess for educational, cultural, and/or spiritual needs that might affect health, teaching, or treatment, as well as the patient's self-image. A needle biopsy or an incisional biopsy of the abnormal tissue will be performed by the provider to assess for malignant or premalignant changes in very small lesions. An excisional biopsy can permit a complete tumor removal. CT or MRI may be performed to determine whether there is a metastasis or if staging is needed. An MRI is useful to detecting perineural involvement and evaluating thickness in cancer of the tongue. So what are the interventions? By surgical excision, radiation, and surgery. Also, they are going to maybe choose cryosurgery or radiation surgery. We explained in previous chapters about cryosurgery. Maybe they are going to choose chemotherapy, which is the patient is going to be exposed most of the time to multimodal therapy, meaning a combination of radiation, chemotherapy, and so on. Okay. Most surgery is often used to remove basal cell carcinoma of the lips. Airway maintenance to facilitate gas exchange is the priority of care for patients with oral cancer. Okay, that's the most important because the nearby pathways close to the pharynx. Non-surgical management is going to be done to promote a gas exchange, remove secretions, and prevent aspirations. Assess for dyspnea resulting from obstruction or excessive secretions. Assess the quality, rate, and depth of respirations. Auscultate the lung for adventitious sounds such as wheezes caused by aspiration. Wheezes caused by aspiration. Listen for stridor caused by partial airway obstruction. Promote deep breathing to help produce an effective cough and mobilize secretion. I strongly recommend you, strongly recommend you to review your breathing sounds, okay? Your lung sounds. Strongly recommend you. Not only the assessment on where to position the stethoscope, but also to be familiarized on how stridor is, how your crackle sound, and everything. Okay, strongly recommend you. Place the patient in semi-fowler or high-fowler position if the patient is able to swallow and the gag reflex is intact. It is beneficial to encourage fluids to liquefy secretions for easy removal. Okay, you can do chest therapy also to help the patient with that purpose. Steroids which reduce inflammation may be prescribed for edema associated with oral cavity lesions. Okay, antibiotics may be prescribed for infection. A cool mist supplied by a phase stent may help with oxygen transport and edema control. So we have another action alert. So aspiration precautions must be instituted for patients with oral cancer. Okay, aspiration precautions must be instituted for patients with oral cancer. Assess gag reflex, that's logic, the ability to swallow. Keep suction equipment nearby, right? You don't want the patient to be having a complication because you didn't remove the secretion. Feel patient at risk for aspiration in a small amount. So the patient at risk for aspiration must be fed in a small amounts. Thickening liquids may be needed. Collaborate with the speech language pathologist who may recommend a swallow study. Perform oral hygiene every 2 hours. Use a soft bristle toothbrush or a ultra soft chemo brush. That's very popular for patients that are going through chemotherapy, right? Especially for patients with a low platelet count. Okay, and here I don't need to mention that you need to know your platelet normal levels. Okay, 150 to 450, 150 to 400 in some laboratories. Do not use oral swabs or disposable foam brushes, which do not adequately control bacteremia, promoting plaque, and may further dry the oral mucosa. Okay. Again, do not use oral swabs or disposable foam brushes, which do not adequately control bacteremia, promoting plaque, and may further dry the oral mucosa. And that's good to know. Okay, NCLEX alert all the box in action alert. Avoid using commercial mouthwashes that contains alcohol and lemon glycerin swabs. These substances can cause a burning sensation. You don't want to put the patient in more discomfort or pain, right? And contribute to dry oral mucous membrane. Encourage frequent rinsing of the mouth with sodium bicarbonate solution or warm saline. Follow agency or primary healthcare provider protocol. So then, surgical management. They are, depending on the type of stage of cancer, they are going to do dental extracts and implants, glossectomy, which is removal of the tongue. There's a long list here. Mandible resection, full or partial, laryngectomy, neck dissection, partial, modified radical, or radical removal of lymph nodes, and the list goes on and on. Preoperative care, the most important for patients undergoing same-day procedures on an ambulatory basis, such as the scalpel, laser, or cryoprobe removal of erythroplakia or leukoplakia. Okay. Document the patient's level of understanding of the disease process. Preoperative oral health reduces postoperative. So the more they understand preoperative, they are going to reduce postoperative inflammation and complications. Operative procedures. The procedure chosen for isolated tumors is dependent on the size, stage, and location. Now, postoperative. Here come nursing care. Okay. Patient is going to have liquid diet for a day and then advances to diet as tolerated. That is your job, nurses, right? But before the patient advances to a good diet as tolerated, nurses need to perform assessment and they need to report to the provider because you nurses are the ones that are spending most of the time with the patient, right? Care coordination and transition management teach the patient who underwent a minor procedure for localized oral cancer about nutrition therapies. Okay. Now it says that we can review box 46.4. Where is box 46.4? Probably you can go and review that box by yourself. Now, let's talk about sialadenitis. Acute sialadenitis, inflammation of a salivary gland, is bacteria or viruses commonly associated with cytomegalovirus. And what is cytomegalovirus? It's a type of herpes virus, again, that can infect almost anyone. Most people don't even know that they have the cytomegalovirus because it rarely causes problems in healthy people, but it can be dangerous for certain groups. The virus spreads through body fluids like saliva, urine, blood, and breast milk. So there you go. You have in this chapter your herpes viruses, your HPV, your Epstein-Barr, your cytomegalovirus, okay? Patient and family education at home care of the patient with oral cancer. This is the box that they were talking before. These are all the recommendations for at-home care. Inspect the mouth, continue meticulous oral hygiene, use the ultra soft toothbrush, keep all follow-up appointments, use a thickening agent for liquids if dysphagia, eat soft foods if stomatitis occurs, use saliva substitute as prescribed. So that's for oral cancer. In terms of sialadenitis, we present the condition as the inflammation of salivary gland, and is caused bacteria or viruses commonly associated with cytomegalovirus. They cause also immunologic compromise, HIV infection, Sjögren's syndrome, We know already about Sjögren, dryness of the eyes, saliva, and the vagina, right? Systemic drugs, phenothiazines can cause, and tetracyclines, which is your antibiotics, and the phenothiazides are antipsychotics. They can cause this inflammation in the salivary gland called sialadenitis. Okay, acute sialadenitis most commonly affects the parotid or submandibular gland in adults. Okay, in the parotid or submandibular gland in adults. Untreated infections of the salivary glands can evolve into an abscess, which can rupture and spread infection into the tissues of the neck and the mediastinum. Dr. Matalana, what is mediastinum? It's the central compartment of the thoracic cavity. Okay, know your map. The best prevention for acute sialadenitis is adherence to routine oral hygiene, which prevents infection from ascending to the salivary glands. Interprofessional collaborative care: assess for ionizing radiation to the head or neck area, right? You need to assess for drug history because you need to double check if the tetracyclines or phenothiazines were present before, right? We need to assess for systemic illnesses, especially ones in which immunity is compromised. Oral cavity for dryness, pain, and swelling of the face in the area of the affected gland. So, illnesses in which immunity is compromised includes your Sjögren syndrome. Remember, this Sjögren syndrome is an autoimmune condition, right? Conservative care is directed at treating the underlying cause, teach the patient to stay hydrated, apply most heat, and massage the gland by sweeping the fingers along the course of the gland with gentle pressure. Pain and inflammation can be managed with NSAIDs, and antibiotics will be prescribed if infection is suspected. The salivary glands are sensitive to ionizing radiation, such as from radiation therapy or radioactive iodine treatment of thyroid cancers, right? Exposure of the glands to radiation produces a type of sialadenitis known as xerostomia, which is very dry mouth caused by a severe reduction in the flow of the saliva within 24 hours. So frequent sips of water and frequent mouth care, especially before meals, are the most effective intervention to address xerostomia, which is the very severe form of reduction in the flow of saliva. Frequent sips of water and frequent mouth care, again, before meals, okay? So factors contributing to decrease lower esophageal sphincter pressure. I think this belongs to the next topic, so we don't want to review this box yet. Now we're switching gears to esophageal conditions, okay? Esophageal conditions. And actually, I believe we're going to stop here, and when we come back, we're going to present these topics, okay? As a reminder, this is the chapter related to concepts of care for patients with oral cavity and esophageal conditions. When we come back, we will review the esophageal conditions. Thank you.